Hello, Wellbeing clinicians. I'm Ali Nasseh, and I'm back here with Dr. Sharona Dayan, who's been kind enough to spend a little time with us today and talk about the role of a very important public health disease called diabetes in periodontal health and in the body as well. And in the first part, Dr. Dayan, we talked about what diabetes is, what is the role of, how does it cause inflammation, how it's causing and affecting patients in terms of cancer, periodontal disease, and other kinds of bodily system problems. And we also talked about the A1C and how you can test it clinically, chairside. Now, I would like to ask you a couple questions about the role of diabetes on dental decay, which is clearly a very significant and big problem that affects patients and is one of the functions of dentists and general dentists to deal with. So, is there a relationship between diabetes and dental decay?
Yes, there is. Diabetic patients are more prone to developing dental decay for a number of reasons. First, there are higher levels of sugar in the bacteria and in the tissue, in the saliva and in the tissue. So the teeth are exposed to higher concentrations of sugar. Secondly, many diabetics have dry mouth. Because there is so much sugar in the body tries to get rid of this excess sugar by increasing the frequency of urination. And so the patients lose a lot of fluid, and this renders them to dry mouth. In addition, they are probably on many medications that cause dry mouth. So that is another reason why diabetics are more prone to developing decay. And the third reason is that because of the high urinary output, a lot of the magnesium is being lost from the body. Magnesium is the fourth most abundant mineral in the body. It does help to help the patients have stronger teeth because calcium and phosphate can't incorporate into the enamel effectively without magnesium. So the diabetic patients do have magnesium insufficiencies, many of them, and this also contributes to the risk for dental decay. And I'll just go over some of my favorite products to help patients with their decay issues. My favorite being the 5% sodium fluoride varnish that's applied chairside during a cleaning. Many studies have shown that applying the sodium fluoride varnish twice a year can reduce the risk of decay up to 60%. And then, of course, we have fluoride trays, prescription fluoride mouth rinses, xylitol chewing gum, and the new generation of products that's being produced are oral lozenges that have oral probiotics to help shift the flora of the mouth from unhealthy to healthy, and this can also help patients prevent dental decay.
That's wonderful. So that's great. What about the patient's ability to get implants? Are implants indicated in patients that have diabetes, and to what extent, how do you judge whether a patient can't tolerate an implant if they are diabetic or not?
Yes, a well-controlled diabetic is absolutely a candidate for dental implant and any other procedure that dentistry has to offer. One study has shown that in poorly controlled diabetics,